tattle.
Oh, jeez.
Okay. From the creators of Rick and Morty, today we are breaking down the crazy medical type situation on the Hulu exclusive TV show Solar Opposites. This is my first time watching Solar Opposites, but I love getting to review alien medicine on these types of shows and see how it compares to human medicine. But before we get into it, if you are new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an ER doctor. If you enjoy the educational reaction videos that you see here on this channel as well as the other stuff, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in. That looks fun. Oh. Breaking through windows is pretty hard to do. You're gonna cause lacerations and a lot of injuries, broken bones, those sorts of things. It does occur. What the? Oh! Oh! Dogs, especially like that type of dog, really strong gripping power. I've seen people's forearms ripped off with these type of injuries. Depending on them, we won't close them. Or if we do, we actually suture like almost every other. It's a high chance of it getting infected because they're dirty wounds.
He's lost too much of what I'm really hoping is blood.
We lost a lot of blood. We can get blood back. Sometimes in an emergency, you could just do O negative blood. So it's just like universal for everybody. But you typically save that for super emergencies where you don't have any time to wait.
Thanks for saving my life.
Thanks for not dying.
Aw.
I'm still gonna tattle.
Oh, jeez.
Okay. It's a little injury prone, it happens. Look both ways before you cross the street, especially when ambulances are around. They're running to an emergency and they're flying down the road.
Guys, we have a big problem that Jesse caused.
We grew flowers on our heads. We know it's a puberty thing and that we're turning into adults.
What's puberty?
You know when humans grow hair and bleed out of their penises and stuff?
Oh, that's
Puberty.
Human, you don't get to have a puberty. You grow into our size and then eventually turn into a wise old tree. And if you're lucky, someone uses your body to build a house.
You know, sometimes it's kind of like correlated back to us. So if our body is dead and we become an organ donor, then we can live on in somebody else's body or get buried in the ground and we decompose and we go back to the earth.
The only way to stop this infection is to inject the serum under their skin.
A weird fungus on the skin. We get weird funguses on our skin as well. It's not puberty. Puberty hits at different ages. Facial hair for guys, women go through their menses, their bodies start changing as well.
We have to use these emergency medical weapons.
We get to cut people.
Whoa, cool.
Else because of the sci-fi goo the blades emit.
I love this sci-fi goo that helps heal the wound. We have like knives in the operating room that cut and cauterize. Same thing, so they're cutting and then they're sealing. Kind of similar, we got that. Oh man, what? Whoa! Oh my gosh. We do get people come into the emergency department delirious, out of their mind, psychotic. Most of the time that is related to substances.
Thank you.
Awesome.
Don't worry, they won't remember any of this.
But they're gonna remember I'm cool, right?
No, at best they'll remember that you aren't.
Okay, there's not really any equivalent to what we got in the hospital, but watching it and being entertained, that was awesome.
You know what's gonna happen right now because you did that?
Yeah.
Now I have to take these guys out with lethal force.
I'm gonna stick my knife up your... Ah!
Oh! Oh! Freaking awesome. I wasn't expecting that at all. Could you puncture through somebody with a fist or kick? No, right? We know this. We actually see injuries like that. A lot of people sadly can get like blunt force trauma to the face or the neck or the head where even though it's not a sharp object, it could go through depending on how much force is being delivered one way or the other, falling on it versus it getting shot at them. Whoa! I want to dissect this for a second. Look at the anatomy. You know me, I'm an anatomy buff. We can see intestines down in the bottom. You see open rib cage, and then obviously you just see like the heart. You can see an atrium and a ventricles, and they're doing a good job. You can see some of the vasculature around the heart as well as the major vessels coming off of it.
Shoots on autopilot.
Wow. I've actually taken care of people where their hand or their forearm gets ripped off. But most of the time, if it's something's ripped off, degloved off, or like destroyed, you can't reattach it. You actually just have to kind of cut the bone down and cover it with the skin that's left and then deal with the prosthesis later.
All right, next time.
Sorry.
Wow. This is like mass destruction. Like, don't mess with these kids. Do we see a lot of injuries in the hospital where limbs aren't attached? Yes, we do. I work at a trauma center, so we do. But if it's an isolated injury, missing a leg, missing an arm, missing fingers, those sorts of things, try to bring in the appendage that's missing, but most of the time we can't reattach it unless it's a perfectly clean wound.
We could dissolve her.
I'll get the acid. This is wrong. She's right. You should hit the side like ketchup.
HCl is probably what they're using. Hydrochloric acid. I don't think it would survive in like a plastic container, right? It would probably melt it. Let me know. We don't use this type of acid in the hospital.
We'll plant your pieces and you'll grow into a beautiful new girl.
It doesn't work like that! Can you just wipe my brain?
What's a brain?
First thing with any burn of a chemical, you got to get the chemical off of you. Anytime you have a burn, here in the United States at least, call your poison center and then it will guide you what to do. And then actually when you go to the hospital too, typically the hospital staff calls that same poison center to get guidance because these aren't super common occurrences, so they know exactly what antidote to use.
Why are you dissecting your classmates?
Despite having been examined by countless scientists over hundreds of years, the human brain is still a mystery.
Plus, she was mean to us.
That is actually really true. So the human brain is actually pretty mysterious. People can have strokes, dead tissue in certain parts of the brains, and there's no outward sign of it. We know specific areas where it has to do with like motor, sensory, balance. We have all of these generalities. Every single spot of the brain, we don't know. It's actually pretty darn impressive.
Everyone is mean to them. I didn't invent it.
So, you can't shrink people.
We weren't gonna kill her. We were just reprogramming her a little.
Are we in trouble?
Yes.
We will discuss your grounding later. Sew her up and let her go.
You're ground.
Oh my gosh. Oh my gosh. Her brain is open. I didn't see this. Oh my gosh. So the brain is insensate. Brain itself does not have pain receptors. How cool is that? And she's talking. Sometimes during brain surgery, the patient is awake. Yes, they can't feel anything, but they're awake to be able to monitor like different parts of the area of the brain they're working on so they know where they're at. How freaking cool is that?
Just keep doing that until she's cool.
Someone's going to prison. I'm a sunflower.
Wow, it really is making her dumber.
So they're saying basically all the sugar and caffeine making you stupider faster. No. So sometimes you need the stimulant of caffeine to get through whatever you need to get through. Sugar sometimes gives you a good up, but it also has a bad crash to it. I'd advise drinking water as much as possible. Maybe throw some electrolytes in there or just throw a little bit of salt in there.
I can't believe humans drink this stuff.
Diet sodas have different types of sweeteners in it that have no calories. And it's got artificial flavorings, that sort of thing, to hit our taste buds. There has been an association with diet sodas and obesity and diabetes. They don't necessarily cause it. It typically is related to the fact that the sweetness of the soda triggers parts of our brain where it wants us to eat more sugary things, thus leading to these obesity diabetic situations. Not necessarily the non-caloric drink that you're having.
Elizabeth, born blind. Let's see what we can do about that. There you go.
I can see all the smells and sounds. It's amazing.
Really cool about the eyes. We can do transplants of the cornea, which is the covering of the eye itself, but you can't do the eyeball. Typically, you basically get a prosthetic eye if you need it.
The only reason he knows what you want is because he's been inside your pee. That's right. Nanobot Man has been spying on you this whole time.
Wow, cool technology, nanobot. What can you analyze in urine? So you can check out the pH, you can check out like proteins and bilirubin and sugars, see if there's infections, white blood cells, red blood cells. You can test them for drugs. Kind of weird. I don't know what other technology these nanobots are extracting from your urine.
We harvest the data for the good of the community. How else would we know that Dave needs a new shed for all his sex dolls? We can give him that shed.
That's not true. I have sex with living human beings.
Well, way to call out your buddy in the middle of a town hall meeting. There is nanotechnology that is out there, and hopefully they continue to develop it and use it for medical purposes, not for spying purposes and doing all this negative components of it. I love the show. I want to see more of this. If you guys like this show, I guarantee you're going to love checking this show out. Let me know if you like it. And as always, make sure you subscribe, turn your bell notifications on, like all my videos. Thank you so much for watching and stay healthy, my friends.